to have you here today. Appreciate you taking the time. Tell us a little bit about the dramatic effect through both diabetes and moving into kidney failure, renal disease, preventing dialysis, even your remarkable success in having some people come off of dialysis and using ProArgi-9 Plus and the other products.
Well, this has been one of the major things that I was doing, and I never understood it. Back in the period in 1990 to 1996, we were seeing a lot of people who were well into their diabetes, well into their kidney failure, and we were being involved with them. And I didn't realize what I was doing, and I really wasn't able, because I had no database and anything to follow it very well. But one of the financial people that I had hired from Boston to come and work with a company I had set up then got all done, and we were losing our funding from Abbott Laboratories. They weren't going to fund us anymore. And he said, you know, the most remarkable thing that you have done is that you've seen everybody, they come in with kidney failures, and they don't progress. And he said, I just scanned the data, and looking it over, if somebody has a creatinine of 2, they never get worse. And, you know, this is the most remarkable thing. This was echoed when the Office of the Treasury just called us not too long ago to say, you know, what is it you do? I mean, do you have a magic sauce of some sort? Do you have a secret? Will we ever be able to know the secret? I said, secret? My God, I'm traveling all over the place. What's secret about this? Yeah. And I'm going to do it on TV, too, and so forth. I was just saying, you know, that you got to realize the physiology of this. And a lot of physicians learn something, and this is very true. A lot of physicians learn something in medical school, and they'll never relearn it again. I wish I could say something different. I wish I could be prouder of my compadres, but I just get so upset when they say, I've never heard of that. I feel like I'm getting a stroke. Because what you have to realize is that the kidney is nothing more than a ball of little tiny microscopic vessels. That's all. It's in a nice carrying case, if you will. And it processes 25% of all your blood flow every minute. And so that's what it's doing, cleaning house. This is really important. But if you have diabetes, these small vessels, the hallmark of diabetes, get very small, they get very narrow, and they begin having big round scars around it, and it's going down, 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 and be really small. Now, the people who are trained in nephrology, which is kidney specialty, have had, like I believed, you can't change a scar. It can't be something different. And you have something like in the arteries, when it's bad, it'll never be good again. Well, of course, we said 3 or 4 times already today, that's not true. You can reverse it. And I have the #1 cardiologist in all of Europe said, no, you can't get it. And I believe the same thing. If you can do it with the big arteries, why not the small? How do we keep it at 4? How do we keep it at 5 and then run it down to 2 again? I'm talking about the creatinine. You do it with the D and you do it with the arginine. It's that simple. Now, having said that, in kidney failure there's a lot of difficulty going back and forth, and you have to focus on a lot of other things, watch the magnesium, the potassium, because the clearance mechanisms are not normal. But one of the proudest days of my life was last Monday, when a patient whom I've known for 25 years and shepherded through all kinds of things, he had type 1 diabetes since about age 4, and he's now about 71, and he got in, had something happen in an accident, and all of a sudden his arteries in the legs were injured, and they closed up. And he had to have both arteries replaced. I think it was an auto accident. And what they do in replacing now, they take the veins out. Veins are the carriers of all the old blood back up to the heart, so they can have other ones that'll work. So they had them taken out, and what you're supposed to do is take them out, reverse them, put them back in where the arteries were. They've got the lining for blood flow and everything else, and they work beautifully. But Stanford put them in backwards. They had valves. They wouldn't let the blood flow. His legs were dying in about 35 minutes after the operation. They couldn't figure out what went wrong. It was weeks before they found out their mistake. And by that time, his creatinine was 1 when he went in, was 5. 5 in universal, talking to nephrologists, saying, you cannot return it. It cannot be normal again. You have to take the kidneys out, give him new ones, and dialysis until you need to do this. I've never done that. And this guy was a real test. So it happened that as a good, really good young nephrologist at Stanford says, we'll get you off dialysis, but we got to do it for now. You got too much junk floating around. And he looked at him and he said, you really mean that? He said, yeah, I do. How long? He said, about 6 weeks. Oh, my word. So he toddles in the other day, and I say, how's your creatinine? I know you had it measured last Friday. He says, it's 3. And he said, I have had my last dialysis. He's got on my program to get everything in play from his standpoint. It'll be really good so you don't have to be on dialysis anymore. But what I see is what this nephrologist told me is he said, we need the two of us. You understand how to use the arginine and the D. I understand how to do all the other little funny things we do. But between us, we're taking people off dialysis.
So that was with arginine and the D that enabled that to happen, despite the medical mistake in the surgery.
That's exactly it.
So your experience has been that because the kidneys and other vital organs are primarily made up of blood vessels, capillaries, etc., that the arginine and the D restore the health to the cardiovascular system in such a dramatic way. And then if there's inflammation of any type, like pulmonary hypertension or chronic illness, then the Mystica would help build the immune system and help the body fight off that, as well as cancers. And then going on to the core greens to alkaline the body and the body chemistry so that the body would be more receptive to what the arginine, the Mystica, and the D3 was bringing to each cell.
That's exactly right. And there's one more thing you all must understand. This guy is fantastic. I give my doctor speak, and I'm just floored at the success we have. He listens and he understands it all, and he says it so you can understand it. Thank you.
Thank you.